L&R USA Inc. is a global medical device and supplies company with a 160-year history of designing and manufacturing innovative compression therapy and advanced wound care products. As part of our commitment to provide the best possible compression therapy solutions, we have prepared this video demonstrating the measuring guidelines for L&R's Tribute Night custom therapeutic nightwear compression garments, part of the Solaris collection of garments and wraps by L&R. All Tribute Night garments are custom designed and fabricated for style and donning preferences. The measuring positions indicated on the order forms are for reference only. Use your professional judgment. The most appropriate measuring locations will vary depending on your patient's presentation. As you take each measurement, record it in the appropriate space on the order form as shown. And remember, all measurements are taken in centimeters. Since Tribute Night garments are most commonly worn while the patient is sleeping, we recommend measurements be taken in a supine position. If necessary, measurements can be taken in standing or seated positions, but always indicate on the order form the position in which the measurements were taken. In extreme presentations, measure the lobules, breast, or pannus in a supported position. Note that when skin folds are present, measure the largest girth. Additionally, you may measure the circumference under the skin fold. If there is girth fluctuation, indicate the girth range on the form as shown. Begin by marking length reference points on the patient's lateral torso and shoulder. You will use these marks later when measuring circumferences. The patient's natural waistline is designated as 0 on the order form. We recommend upper torso garments extend below the transverse watershed, approximately 5 centimeters below the waist at the determined H position. Take the corresponding H circumference measurement and record as shown. Then, positioning the tape measure at the waistline or determined 0I position, measure to just below the breast or determined J position and record this measurement. Continue to measure from the I position to the mid-breast, the fullest part of the breast line, and record your measurement. Continue to measure from the determined I to the L position at the level of the axilla and record your measurement. To determine the shoulder width, or M length, measure from the HPS, high point shoulder, or base of the neck, to the acromioclavicular joint. The N length is taken with the patient holding the tape measure at the determined I position or waistline. Measure from the midline anterior waist over the shoulder to the midline posterior waist. Record the measurement on the form as shown. For the O length or armhole, measure from the acromioclavicular joint under the axilla and back to the starting acromioclavicular joint 360 degrees. Now, using the marks you've made as reference points, measure and record circumferences. To determine the I circumference, measure the circumference at the determined I or 0 position and record on the order form. Measure the circumference at the determined J position, lifting the breast if necessary. Record your measurement on the order form as shown. Measure the circumference at the determined K position and record this K circumference on the order form. For unilateral mastectomy, measure the left and right side independently from anterior midline to spine. Use the comment section on the bottom of the order form to record unilateral measurements. Finally, measure the L circumference above breasts at the determined L position and record. Your measurements are now complete. Next, you can choose to customize your garment further with modifications and design. At L&R, we are committed to helping your patients receive the full benefit from their 100% custom Tribute Night garment. We hope this video has provided a user-friendly guideline for measuring with L&R's forms. Should you have any questions regarding a custom design or selecting a style of compression garment for your patient's individual therapeutic needs, our Design Center team is ready to help and available by phone, email, or video conferencing. Thank you for your continued business and for choosing L&R USA Inc.